My name's AJ Blackburn. I'm a hand and upper extremity specialist for South Florida Orthopaedics. My area of expertise starts at the fingertips, and the majority of what I do is hand and wrist based. Everything from the common conditions like trigger digit, carpal tunnel syndrome, thumb arthritis, moving up to the elbow where cubital tunnel syndrome, another nerve compression syndrome, is very, very common. And then moving up to the shoulder where rotator cuff tears, labral tears, shoulder replacements, arthritic conditions, AC joint arthritis. So hand upper extremity specialists are the watchmakers of orthopedics. We like doing the detail work. We like the complexity of the hand. For me, hand and upper extremity surgery just allowed me to work in an area where the difficulty and the complexity keeps me engaged in not only the learning but also the treating of these conditions, and that's where I fit. My specific area of personal interest is mainly in thumb arthritis, carpal and cubital tunnel syndromes, trigger digits. Frankly, those are the ones I enjoy treating most. Those patients are the ones that get the most benefit, the quickest, immediate return on their investment of time and effort when dealing with those conditions. Most rewarding part of what I do as a hand surgeon is helping a patient work through what is oftentimes a very impairing issue in their life. So if the patient were dealing with thumb CMC arthritis or arthritis at the base of the thumb, pinch, grip, turning keys, opening doors, handshakes, all the basics of life are immediately impaired by that pain at the base of the thumb. When you can't hold a coffee cup first thing in the morning, you're reminded that you aren't okay. And hand problems are problems that will immediately cause problems, and when fixed, make a tremendous difference in your life right off the bat. Carpal tunnel syndrome and cubital tunnel syndrome are two peripheral nerve compression syndromes. If you have one of those problems, you're going to have numbness, tingling, weakness. The simplest of things like tying shoes, dressing, and doing buttons become impossible. And when you can't do the basic functions of life, when you can't sleep through the night without numbness of the hand, knowing that you have a place that you can turn to, have the problem correctly identified, and then get a number of solutions to the problem, both conservative and surgical, that are going to fix the problem, is what makes hand surgery so rewarding for me. It's typically outpatient, simple procedures, even when required, and you'll immediately improve thereafter. And when a hand is better, it just improves every aspect of your life. You're interacting with the world more simply and with less pain. And for me, that's what makes hand surgery special. What attracted me most to this community and this practice in particular was the reputation of the practice. Frankly, I wasn't inclined to join a practice that it wasn't stable or well respected. In meeting the partners when I came down, what I could immediately see is that their focus was on quality. It's the highest quality care in the most efficient way possible. The practice wasn't willing to tolerate, long wait times, inefficiencies in the office. It's not a practice that you should be frustrated with the process. It's our top priority that when you come in, it is a good experience from start to finish. From the time you check in up front to the time you come back for imaging, any additional studies that need to be ordered, the entire thing should flow. The whole process should be straightforward. You should understand every step of the process. We don't want our patients having to bounce all over town, waiting for appointments to become available for a 5-minute visit where questions aren't answered and treatment plans aren't explained. I appreciated the fact that the doctors here prior to my joining were providing high quality care and the patients were happy, and I've continued to do that for the past 3 years that I've been with the practice. Patient satisfaction is our top priority. We want it to be simple. We want you to understand what we're choosing to do and why we're choosing to do it, and we absolutely want the patient engaged. We want them to be part of the process instead of being told what to do. that era of medicine is over.